name come up as well. So Kimberly Franklin is the senior legal counsel here at the Nova Scotia Human Rights Commission. So I'll now that I see her name, I'll definitely refer to her as well if she's got some good insights to add on some of the questions.
She has some insights to add. She'll just say, and she can take herself off of mute, or I'll take her off mute, whatever works best.
Great.
Hello, Ms. Go. Where are you chiming in from? Sarah is here.
Hi, I'm calling from Toronto.
Good to have you. And I'm not going to be rude, but I'm going to put you on mute now. Thank you. And Sarah is here. Sarah's connecting to, can't hear you yet, Sarah.
Hello?
Yes, can hear you now. Fantastic.
Okay.
All right, so what we're gonna do is put it here. Okay. So Sarah, should we wait for Mr. Richard, or you think we're good without?
No, isn't Richard gonna be like the first speaker?
Yes.
Yeah.
I just wanted to test you.
No.
No.
I do TV. We do things in order.
I know. I'm just playing. I know. Just waiting for Richard to sign in. We can get started.
You've been really busy, haven't you?
Who?
You, with all of these call-in shows about COVID. My goodness.
Well, I like to stay positive, productive, and people like yourself and I, our workload has doubled over the last few weeks, right?
Well, no, well, at work, yes.
Yes.
But not community-wise.
Yeah, community-wise.
Because I'm boots on the ground. I'm usually going to events, covering events, organizing events.
Okay.
And so there's nothing.
Well, my
everything is online.
My digital boots have been on the ground.
Yeah, there you go.
So it's been usually days from 8 o'clock till 8 o'clock.
Wow.
But it's all worthwhile.
Yeah.
Absolutely worthwhile. And forming collaborations and relations with people all around the world, because this is the best time to get a hold of them.
This is true. Supper time.
We're all available.
And no one, as Christy said, no one's going out to dinner.
Yeah.
Or lunch. Good. And welcome to June. Welcome to Anne, Chantel, Stephen. Welcome. We're just waiting for, I guess, our producer. Don't know what's holding him up. Maybe I'd like to send him a text message, but my phone's in. Oh, here he comes. Hello, Richard.
Hello, good people.
How you doing?
I am doing very well, thank you. I was sitting
changing.
Nope. I was.
Look at you, all dressed up for the meeting.
I heard that I heard there were some commissioners on the line, so I thought I'd put on.
Boy.
Thought I'd put on one of my good shirts.
Excusez-vous.
All right. So, Richard, are we ready to go?
Yes, we are.
Okay, so thanks, everyone. We're going to get started in a moment. The next time you hear me live, we're going to get started. And let me just change one thing here. Okay, so next time you hear from us, we will be live. Bear with me a second, folks. Just having a little bit of delay. Everyone just hang on a second here. Zoom is not behaving. Okay, here we go. What is up, everybody? It is Dr. Vibe here and wishing you a very good day, very good weekend. And here with another collaboration between the Dr. Vibe Show and also the UNDPAD Coalition. And very happy. We have another epic conversation here today and another special conversation here today. And before we go any further, I'd like to welcome my co-host, Sarah. How are you today?
Bonjour, bonjour, ça va bien?
Ça va bien, merci, et vous?
Oh, ça va très bien.
That's as good as you're going to get from me. I'm not
Voilà.
going further. I don't want to shame myself, but and we are here. We're going to host a great conversation today. But before we give any more information on it, we'd like to have Richard explain a little bit on the UNDPAD Coalition. So, Richard, the mic is yours.
Thank you very much, Dr. Vibe. I appreciate everybody joining the call today. It's a pleasure to be here today and have some special guests to talk about something very important and dear to my heart, which is human rights during the time of COVID-19. Just a little update and refresher for those of you who do not know. The UN Decade for People of African Descent Push Coalition is a group of folks from across the country that have gotten together over the last year to support efforts around federal government funding and programming for people of African descent in Canada, commitments that have been made through the budget commitments specific to the UN Decade for People of African Descent and the betterment of Black Canadians and people of African descent living here. We have been working with governments, federal governments and other stakeholders, community stakeholders from across the country to try to bring voice and take a little bit more of an activist perspective on moving those kinds of funding commitments forward. We're also partnering with other organizations to amplify other voices. We're supporting these conversations online, and we're also engaging in slightly different engagements around COVID-19, around how best to support funding that is going out for emergency funds that actually have a chance of reaching some of our Black and racialized communities who are most at risk during this time. So that's a little bit about us. And again, thank you all for joining us. I'll pass it back to Dr. Vibe and Sarah.
Thank you so much, Richard. So we have two special guests today. I'm going to introduce our first guest, Marie-Claude Landry, who was appointed as Chief Commissioner of the Canadian Human Rights Commission in March 2015, marking a new phase in a career defined by deep and ongoing commitment toward community involvement. A native of Montreal, Quebec, she obtained her Bachelor's of Law from the University of Sherbrooke back in 1988. She is a member of the Quebec Bar Association and founded her own law firm in Cowansville, Quebec in 1993. Sarah?
Et je vais répéter en français puisque Madame Landry est québécoise. Marie-Claude Landry est présidente de la Commission canadienne des droits de la personne depuis mars 2015, une étape nouvelle de sa carrière marquée par un profond engagement dans sa communauté. Originaire de Montjoly, province de Québec, Madame Landry a obtenu un baccalauréat en droit de l'Université de Sherbrooke en 1988. Elle est membre du barreau du Québec et elle a fondé son cabinet d'avocat à Cowansville en 1993.
Wonderful, very, very much. And just want to remind everyone to please put themselves on mute if possible, would be much appreciated. We just want to make sure that this is the best experience for everyone live here. So next up, I'm going to introduce our other guest. And just going to put up here Christine Hansen. And Christine, could you just introduce yourself very quickly to our audience? Oh, you're on mute. Can't hear you.
How's that?
That's
Yes.
better.
Is that better? I apologize.
No
It's
problem.
actually raining really loud here too. The skies have just opened up in Halifax. But it's very nice to be here. Thanks for including me. I'm the director and CEO of the Nova Scotia Human Rights Commission. I was appointed about 4.5 years ago. Grew up here in Nova Scotia, but spent most of my career away with global affairs, working in Ottawa, New York, and Washington. So just thrilled to be living back in my hometown and working on human rights full time. And thanks again for letting us join you.
And Sarah, you want to give a quick
Oui.
transition?
Ben, rapidement, non, je n'ai pas ici. Ah oui, Christine Hansen est directrice et chef de la direction de la Commission des droits de la personne de la Nouvelle-Écosse. Je vais m'arrêter là.
Okay. All right. So we're going to get right into our conversation here, and we're going to have a series of questions for both our special guests, and they're going to be answering them. And then after we finish our questioning, if people have any questions, whether it's real time or would like to ask them via the conversation itself, please either, if you're on Zoom, click on the raise your hand, or send us a message via the chat room in Zoom. So
And-
first up,
And
oh,
just
go ahead.
and just a second. If you feel more comfortable asking your question in French, I can translate it for you into English for the benefit of the rest of the group. Et Madame Landry, si sentez-vous à l'aise de me demander de traduire lorsque vous sentez plus à l'aise en français.
Thank you. Excellent. Next up, our first conversation piece is for both our guests. Are the COVID emergency measures having a disproportionate impact on Black, racialized, and marginalized communities? Who wants to handle that first?
Yeah, maybe before Dr. Vibe, and thank you, Dr. Vibe, Richard, and Sarah for the invitation. It's really nice to be with all of you. And maybe just before, if you allow me, I would like to have some remarks to put everything in the context. And first, I would like to say bonjour. En ces temps de bouleversement, je suis heureuse de pouvoir être avec vous et de participer virtuellement à cette importante conversation. Je remercie la coalition de m'avoir invité. I thank you very much to invited me to this important discussion on the impact of the measure related to the COVID-19 that affect the person with from the African descendant and the racialized people in Canada. As you have heard, my name is Marie-Claude Landry, and I'm the Chief Commissioner of the Canadian Human Rights Commission. And the Commission is the national institution for human rights in Canada. Notre mandat est de promouvoir et de protéger les droits de la personne et de surveiller la façon dont le gouvernement respecte ses obligations internationales en cette matière. Right now, along with the rest of the world, we find ourselves in an unprecedented times. It is in these times of crisis that the best and the worst parts of a nation are revealed. We are seeing the kindness of strangers and the strength of our communities shining brightly. But we are also seeing the cracks in our society being exposed and critical issues, perhaps forgotten, being brought to light. We all know and have long known that Black and racialized individuals in Canada continue to face discrimination, inequality, and racism in their daily lives. This has been called out again and again by advocates such as yourselves, by human rights commissions, by international human rights bodies. Le COVID-19 met en évidence les inégalités. Inégalités sur le plan de l'accès aux soins de santé, par exemple, sur le plan de l'accès au logement, l'inégalité sur le plan des opportunités à faire progresser sa carrière et mener une vie prospère. La COVID-19 accentue ces inégalités et coûte même la vie à certaines personnes. Ces écarts socio-économiques déjà préoccupants pour beaucoup de personnes racialisées au Canada sont maintenant encore plus grands en raison souvent des mesures mises en place pour adresser la situation de la COVID-19. C'est particulièrement vrai pour les femmes racialisées, dont plusieurs font un travail de première ligne et qui se retrouvent sur la ligne de front pendant cette crise. The disproportionate impacts that we are seeing related to the COVID-19 pandemic and the measures to address it are a manifestation of structural racism. Black and racialized people have long suffered the effect of structural racism in Canada. This is due in part to social and economic disparities, including poverty, poor housing, and inadequate health care. These are systemic factors, and detailed data are needed and will help to develop effective policies and programs to address significant needs and gaps. As a country built on the principles of diversity, freedom, and inclusion, we cannot let inequality, intolerance, and racism undermine our collective peace and prosperity. As our country begins to emerge from this crisis, human rights oversight will be essential. In developing recovery plans, governments at all levels need to reconsider recommendations put forward by human rights experts and rights holders themselves. The rights and needs of all marginalized Canadians, including Black and racialized Canadians, must be baked right into any recovery plans or policies for our society and economy. Les gouvernements doivent mettre en place des mesures spécifiques afin de remédier à l'impact disproportionné de la crise de la COVID-19, cet impact qu'il a eu sur les personnes les plus vulnérables. Les mesures doivent être bien sûr inclure la collecte de données significatives et désagrégées. On ne peut pas améliorer ce que l'on ne peut mesurer, and I repeat, we cannot improve what we cannot measure. Vous pouvez compter, you can count on the Canadian Human Rights Commission. We are a key actor or an agent of change. We will use our voice, and I will use my voice to fight for equality and for a Canada without racism, without discrimination, for now and for the future. And I will be more than happy to discuss and go into this conversation with my friend and colleague, Christine Hansen. And I just want to let you know that I'm also accompanied by two wonderful women. I'm with Melanie Mohamed, who's my Chief of Staff and Director of Outreach, a wonderful, nice, kind, and absolutely precious to me person. And Sasha Hart as well, who is a legal counsel and a wonderful woman, and someone that I really enjoy working with as well. Then thank you for allowing us to be with all of you tonight.
Okay, that's fantastic. Thank you so much. I haven't forgot my question though.
But she partly answered it though.
Yes, I know.
Oui, vous y avez répondu dans votre exposé.
Oui.
Okay, and Christine, do you have a response for that question also?
Absolutely, and thank you again for inviting Nova Scotia to join in on this conversation. I did want to mention, I mentioned earlier on the line, we also have Kimberly Franklin, who's our senior legal counsel, and my right hand here at the commission. She is invited at any time when I'm answering a question to jump in and do what she does. She does Frankly with Franklin, and she can explain she can explain things really well. And if she wants to jump in, just feel free, Kim, anytime. You know, I think I agree with everything that Marie-Claude said. Certainly this high-level perspective that she's offered so far is very pertinent to what we're experiencing on the ground here in Nova Scotia. Absolutely, we are seeing already a disproportionate impact on vulnerable groups here in the province. This was fully something we expected to see: people with disabilities, people living in institutions similar to what we're seeing across the country, racialized communities where people often have unequal access to healthcare, childcare, can typically be underemployed in those communities. So while we're doing the best to stay the blazes home, like the Premier's ordered, a lot of people in those communities are essential workers. So they are being disproportionately impacted by this. We do have, I should say, an outbreak. I'm not sure if you're aware. There's been some media coverage, certainly locally, of an outbreak of COVID-19 in a historic Black community, the Preston communities. So we are kind of living this in real time right now. And, obviously it's concerning. Nova Scotians have experienced a long history here in the province of, structural racism. You might be aware of some of our history even recently around the street checks issue, and the Commission's done a lot of work, and particularly Kimberly Franklin, who has led on this file in terms of a high-profile report that was sent out about a year and a half ago, and then a legal opinion which resulted in a ban on the practice here in the province. So the first jurisdiction to ban street checks is here in Nova Scotia. So obviously, some of these concerns that we have are around the disproportionate impact in those Preston communities. It was really unfortunate how public officials were communicating about that outbreak here in Nova Scotia. It was being cast, unfortunately, and received as sort of almost placing fault on the community for being rule breakers or not following social distancing, public health measures. That was extremely unfortunate, and obviously, it resulted in a public backlash, which was not where we wanted to be. But I do have to say that the government and the community have really been working closely together to help better support the community, and they've been providing things like income supports, door-to-door testing, grocery delivery, basically whatever has been recommended. We have some amazing advocates in those communities, the Health Association of African Canadians, Association of Black Social Workers, the African United Baptist Association. They deserve a huge call out for the work that they've done in community, their leadership, and that outbreak is turning the corner. And I think it just really illustrates the points that Marie-Claude was making about the need to better support vulnerable communities. And I think we'll talk a little bit more about data, because that is so key. Marie-Claude raised that. The data is something that we're very focused on right now at our commission, because I think it just illustrates to us, when we see this disproportionate impact in our communities here, how important it is for us to be able to understand through data. As we learn from our work in street checks, it's really critical to have information and quantitative data to be able to have a conversation and to have really well-informed public policy decisions.
Okay. Thank you. Sarah?
Yeah, I'll ask the next question. And then after we've asked the questions, I'd like to get Madame Landry's take on what's going on in Quebec with the outbreaks in North Montreal, Montreal Nord, with similar sort of reactions to what happened in Nova Scotia. So question 2, is there monitoring in place to determine the societal impacts of these measures on our citizens? Est-ce qu'il y a de la surveillance, des mécanismes de surveillance en place pour déterminer les impacts sociétaux de ces mesures sur les citoyens? I don't know which one of you wants to take that on.
Marie-Claude's on mute.
Sorry, you want to go first, Christine?
Yeah, I mean, in terms of the monitoring of societal impacts, I mean, definitely I would circle back again to say just how some of that is not being monitored because we're not taking care of the business of tracking data. But I mean, we're certainly blessed down here in Nova Scotia. We have an extensive network of advocacy groups and community organizations. They've been raising concerns right at the outset very effectively, talking about the situation of vulnerable groups, and they've been calling on the government to take various measures. We've certainly been also communicating those same concerns with government stakeholders. We put a policy out quite early, a statement on our website that has been updated regularly. We are trying to ensure that stakeholders are putting a human rights lens on this crisis, and that that's being applied when decisions are being made. And I think I would say my assessment here is that overall the response has been quite robust. It's almost like we're witnessing mountains being moved down here. It almost makes you say, why haven't these mountains been moved before? You know, it's getting over an anthill is hard enough. I find some days when you're trying to influence the government, but I am seeing mountains moved. I think that's you know, it gives us hope to see this response. But I do think there's no question nationally, and you know, certainly here in Nova Scotia, we're going to be pushing hard on this issue of data. I mean, really, health, disaggregated race-based data on health side. This has been something we've been talking about this internationally. The UNDPAD of People of African Descent working group of experts came here to Halifax on their visit a few years ago. This was recommended at the time, and you know, some of those recommendations have been implemented. I think this is a really important one, and it's never been so clear just how important this is, because you know, without data, you don't have the tools you need to make really well-informed decisions, and being able to make quick and well-informed decisions during a public health crisis is really key. And it's, you know, it's unfortunate that those supports were not already in place in the Preston communities, for instance. We had to, you know, health officials were scrambling and playing catch up, and they've actually done a pretty good job at doing that. But I think just having a better understanding of what this impact is on racialized communities, it's very, you know, something you can expect is going to happen, and having those supports in place and ready earlier it just makes a lot of sense. And so so we're going to be really laser focused on that as an issue for our commission in the coming weeks.
I'm gonna unmute myself. Thanks.
Okay.
And thank you for the question. I would say that for me, the advocacy group and community organizations and individuals are doing an outstanding job to sounding the alarm about the impact of the pandemic and the response into individual and groups in vulnerable circumstances. The Commission is here to be an ally, as I mentioned, and to amplify the message. We need data. It's clear for us, and I mentioned it in my remark at the beginning that if we cannot improve things that we cannot measure. It's crystal clear. We're doing what we can. For the commission mandate is to promote and protect through the protection is through the complaint system. Then we are closely monitoring actually the complaint that we're receiving in this time of COVID to see if there is any trend and how we're going to deal with it. The thing that we have to be careful is during this pandemic that people are so swamped and so busy and so experience a very difficult time, then I think that we will not see the trend right now, but we will see after, because people will raise their hand after, and they will be able to talk about that and share their experience, and will contact probably the commissions, and it would be the provincial or the federal one. But I think that for now, people are so busy to deal with the challenges that they are facing by the pandemic, then we didn't see a huge trend, but I think that it will come for sure. And if I talk a little bit about Montreal Nord and the situation, it's crystal clear when you're coming from Quebec that you know that this area is an area where there's a lot of racialized people, and someone, a friend and people that I highly appreciate, a person that I highly appreciate, Foni Ami, just had an article yesterday in the Montreal Gazette saying that, you know, the situation is certainly due to the social and economic disparity, including, as I mentioned in my own remark, the poverty, housing, inadequate health care, that the amount of number of people who are in the same house, it's created so many challenges. And many of the people who are living in this area as well are the ones that they're working in the on the front line in the healthcare system, which is another challenge. and we're not, personally, I'm not surprised to see what's going on actually, because it was, for me, it's unfortunate that we didn't have data, but it will be very important to have data, specifically on what happened, what are the consequences, to make sure that we're going to learn from the unfortunate situation that we have actually.
Okay. Please put yourself on mute. Who is on there? And Sarah, do you want to follow up on that, or do you want us to move on to the next question?
No, you go ahead. Go ahead.
Thank you so much. All right. Next question for our guests is, how can people raise concerns if these measures that do a disproportionate impact on ACB and other racialized communities? So how can we raise concerns if we feel that there's something unjust happening during this period?
Well, I could jump in there. I mean, I think we have had some amazing community groups that have been raising concerns right off the bat. And I think it's helped really to see data south of the border in the United States. You know, there's been a lot of really good pieces of research coming out. There has been a huge and disproportionate impact on racialized people south of the border. We're seeing it here. Unfortunately, we can't talk in quantitative numbers because they're not keeping that data here. But so we're hearing concerns. We're also monitoring complaints that we're receiving here at the Commission. We're very busy. Human rights definitely doesn't take a break during a pandemic. If anything, we're busier in a lot of ways than we've been, and it's obviously complicated by the fact that we've been dispersed a bit, but we are monitoring the calls that we're getting in. We're responding. We're keeping track of complaints and trends. We've been regularly raising what we're hearing with government. We're talking a lot to community. We have our Director of Race Relations, Equity and Inclusion, Dr. Case Monroe Anderson, who unfortunately couldn't join us tonight because she had another obligation, has been really talking with community, listening intently, passing on these messages. And I think it helps for us to be able to follow up with decision makers, to be able to raise concerns we're hearing, and to be able to put that into a human rights lens in terms of discussing additional supports that can be provided to community. And because we're still living through this right now, in at least one of our communities here in Nova Scotia, this has been really valuable. And I just think, we've been able to issue some statements that we've put online. We've been talking to media, and there has been some media coverage around some of the challenges that we're seeing in terms of some racist incidents here in the province, but also just talking about COVID and in particular that outbreak. So there's opportunities, and we're trying to use them. And I think just conversations like this are really good, because again, we have an opportunity, and I hope after we answer your questions that we'll have an opportunity to hear from some of the people who have joined us, just to hear from you directly what you're experiencing. If you have concerns that we should know about, then I think that's a great opportunity. I'll definitely be taking some notes.
Alors, pour ma part, je pense que les organisations communautaires, les gens qui sont à la défense, à la tête de différents groupes, font un excellent travail pour soulever les enjeux. I think that the advocate and community organization are doing a fantastic job doing so. I think that, and I will invite people to not be shy to get in touch with the member of parliament, their representative, their provincial one, territorial one, the federal one. I think that this is also things that should be raised through their government representative in their own area. We as a commission we are happy to amplify the voice and making sure that we raise these issues as well. We're talking about that. We this week since the beginning of the pandemic, we have issued 5 statements, certainly one about the inequality that amplified by the COVID-19, the situation of the for women and the gender gap and the effect of the pandemic. And we issue 5 statements, and we will continue because I think that it's really important. Through the human rights complaint process as well, it could be the provincial one, the federal one. It's certainly one of the tools at your disposal to raise issues and concern and talk about what's going on and making sure that nothing will be forgotten. Yeah, it's talking about that. I think that we need to have a united voice, and all the commission are working together. Christine is the chair of CASHRA, with the association of all the commissions in this country, provincial, territorial, and federal one. Then we talk in between all of us, and certainly we can amplify the message.
Okay. Excellent.
We do talk often, and we were actually just talking yesterday, and I was going to say to Marie-Claude, I have a very similar Smythe jacket to the one you're wearing, which I almost put on. So that would have been really funny. It would have been like a human rights uniform. The black and white plaid. You have no idea how close I was.
Yeah, it's the new suit of the Human Rights Commission.
That's right.
That's good. Good stuff.
Yeah,
Sarah?
the last question is sort of along the same lines. What can people do if they feel they've been the target of racially motivated attacks during the pandemic? Que peuvent faire les gens qui s'estiment avoir été la cible d'attaques racistes pendant la pandémie? Like, what recourse do they have?
Well, I mean, I think, if we have had reports. I've heard reports across the country of racist incidents since the start of the pandemic. In fact, we jumped pretty quickly to get a statement released to the media after getting a few reports, which were really concerning. So, we're really trying to raise public awareness and raise vigilance against racism. I mean, I think even us hearing of a handful of these types of incidents are really concerning, because we know that this is really underreported. So if we're getting 10, it could easily mean there's 100 out there. So we're definitely concerned. I think these are incidents that they're both a human rights issue and a public safety issue. And so I think it's really important, if these things are happening, we're strongly encouraging people to contact the commission, the Human Rights Commission, and let us know if this is going on. We do get the information. We will investigate to the extent we can and get involved in a dispute resolution process. It's just really unfortunate, but the color of someone's skin is not going to make it more likely for them to give you COVID-19. But unfortunately, we have a virus that doesn't discriminate, but we have people that are out there discriminating. They're behaving in really irrational ways. So definitely we want to hear from you if you're experiencing this. I think it goes without saying that if there's violence and threats involved, and there has been incidents, not here thankfully, but in other parts of the country where this has occurred, then the police may need to also be involved in a situation like that. But absolutely, and even just outside of the pandemic itself, it's important people contact us to let us know if they've experienced a racist incident or if they've been discriminated against. One of the things that we were very worried about when it hit the news about the outbreak in the Preston communities, we were very worried that this would lead to even more racial profiling and more discrimination for people coming from those communities. So definitely we're trying to be very vigilant here, and so we hope that people will feel comfortable reaching out to us and contacting us, and then we'll work with you to try to figure this out.
Madame Landry?
Alors, merci pour votre question. Je dois dire que je fais écho aux propos de Christine, certainement. Je pense qu'il y a différents moyens de dénoncer. Moi, je suis très inquiète. Je l'ai signalé dans une déclaration qui s'appelle Racism in Response to COVID-19 Harms All of Us, because I really believe that racism harms all of us. Alors, c'est pour moi une grande préoccupation, la montée du racisme les commentaires haineux qu'on a vus, les menaces. Et c'est quelque chose qui ne doit pas être toléré. Et il y a différents outils à disposition, que ce soit dans certaines provinces, les ombudsmen des victimes, que ce soit les commissions des droits de la personne qui peuvent être là aussi pour signaler les situations. Il y a différents organismes qui peuvent venir en aide aussi, parce que la première chose, c'est de venir en aide aussi aux personnes qui subissent le racisme, avec les conséquences néfastes que ça peut avoir. Je suis d'accord avec Christine également que il ne faut pas hésiter, même si parfois ça fait partie des inquiétudes qu'on a de demander à la sécurité publique d'intervenir, et il faut prendre ça au sérieux. Et je pense que c'est un problème qui, encore une fois, ne regarde pas seulement que les personnes racialisées, mais tous les Canadiens. Le racisme ne doit pas être toléré au pays. Alors, c'est inacceptable et chacun de nous avons la responsabilité de le dénoncer quand on le voit. Et ça, pour moi, c'est absolument non négociable.
Okay.
So, for those of you who didn't get all of that, basically she echoed the statement by Christine, but she also added that there's ombudspersons that people can contact and organizations that can help advocate for the victims as well.
Okay, fantastic. Before we open it up for questions, I already have 2 questions in the queue. So as we said at the beginning of our conversation, if you have a question, if you are in the Zoom room, raise your hand or notify us in the chat room. And we have bilingual here, so please take advantage if needed. Before we get to that part, myself and Sarah are going to read messages from the Ontario Commission of Human Rights. So this is a statement of declaration from the Ontario Human Rights Commission. I'm just going to read it here. Just over 2 weeks ago, the Ontario Human Rights Commission wrote Ontario's health minister, encouraging her to mandate the collection and reporting of demographic data critical to effectively addressing the COVID-19 pandemic. This was nearly 3 years after we urged the government to require healthcare agencies to collect, analyze, and report on race data under the Ontario's Anti-Racism Act. There can be no debate on this issue. Human rights and public health experts agree that collecting demographic data, including race, socioeconomic status, and disability, along with sex and age, is the foundation of evidence-based, evidence-informed decision-making. Demographic data also sheds the light on experiences of people with intersectional identities, including, for example, Black people with disabilities or who are older. Strong data also allows healthcare leaders to identify populations at heightened risk of infection or transmission to efficiently deploy scarce health resources and to ensure equal access to public health protections for all Ontarians. If one segment of Ontario's population is overlooked as we fight to flatten the curve, we risk prolonging the pandemic or triggering its resurgence. Without solid data to work in Ontario, we have called on the province to recognize data from comparable jurisdictions, including the United States, which shows that Black people, among others, are disproportionately dying from COVID-19. Looking to this data for guidance, Ontario must adopt action plans for vulnerable groups that include aggressive screening and testing. We know it would take many years to roll out an ambitious, albeit necessary, system-wide data collection initiative, but we still need to make a start during the current emergency. This start can include demographic data collection during testing, when positive tests are reported by local health units during admissions to hospital or intensive care, or when the province reports COVID-19 deaths. The government must collect data to quickly identify and address potential racial or social profiling when enforcing emergency and public health orders. Black lives and many other lives depend on us getting this right. That is a statement, English, Ontario Human Rights Commission, and I believe Sarah will
Oui.
en français.
Pour nos francophones, voici les commentaires de Renou Madané, commissaire en chef de la Commission ontarienne des droits de la personne. Il y a un peu plus de 2 semaines, la Commission ontarienne des droits de la personne écrivait à la ministre de la Santé de l'Ontario pour l'encourager à exiger la collecte et la transmission de données démographiques essentielles à la lutte efficace contre la pandémie de Covid-19. Près de 3 années s'étaient déjà écoulées depuis que nous avions demandé au gouvernement d'exiger que les organismes de soins de santé recueillent, analysent et transmettent des données relatives à la race au terme de la loi contre le racisme de l'Ontario. L'importance de ces données ne peut être sujette à discussion. Les experts des droits de la personne et de la santé publique s'entendent sur le fait que la prise de décision éclairée dépend de la collecte de données démographiques, y compris des données relatives à la race, au statut socio-économique et au handicap, jumelées aux données sur le sexe et l'âge. Les données démographiques donnent également des indications sur le vécu des personnes à identité croisée. Par exemple, les personnes noires qui sont âgées ou ont des handicaps. La collecte de données rigoureuses permet aux autorités sanitaires de repérer les populations à risque élevé d'infection et de transmission, d'octroyer de façon efficace les ressources limitées en santé et d'assurer à toute la population ontarienne un accès équitable aux mesures de protection de la santé publique. Si nos efforts en vue d'aplatir la courbe et négligent une population quelconque, nous risquons de prolonger la pandémie ou d'occasionner la réapparition de la COVID-19. Vu l'absence de données rigoureuses sur lesquelles se baser en Ontario, nous avons exhorté la province à prendre en compte les données qui ont été recueillies dans des territoires comparables, comme les États-Unis, et montre par exemple que les personnes noires ou issues d'autres groupes vulnérables affichent des taux de mortalité disproportionnés des suites de la COVID-19. L'Ontario doit s'appuyer sur ces données pour adopter des plans d'action relatifs aux groupes vulnérables qui incluent des mesures de dépistage agressives. Nous savons qu'il faudra des années pour mettre en œuvre une initiative ambitieuse, quoique nécessaire, de collecte de données à l'échelle du système. Mais nous devons débuter dès maintenant, durant la crise actuelle. Les premières étapes de cette initiative pourraient inclure la collecte de données démographiques au moment du dépistage, quand les bureaux de santé publique locaux font la déclaration des cas positifs, au moment de l'admission à l'hôpital ou aux soins intensifs et ou quand la province rapporte les cas de décès des suites de la COVID-19. Le gouvernement doit également recueillir des données pour cerner et régler rapidement les cas éventuels de profilage racial ou social liés à l'application des ordonnances d'urgence et de santé publique. La vie des personnes noires et de bien d'autres personnes dépend de notre succès à ce chapitre. Allô?
Okay,
You're on mute,
there we
Dr.
go.
Vab.
All right, so we got it. I just want to mention that statement came from Renu Madan,
Madani,
who's the
oui.
head of the Ontario Human Rights Commission. She could not make it for this conversation today, but she did take the time out of her schedule to share that information with us. We now have some time for some questions and some comments. I do see some names of people, so we're going to address them in order. So the first person I have, and if you are still here, Franklin, if you are in the room still, please take yourself off mute and ask your question. Okay. Okay, next up then, we're going to go to Hodan. You have a question or comment. So if you could take yourself off of mute and ask your question or make a comment.
Thank you, Dr. Vibe.
You're welcome.
Hi to everyone. So I just wanted to make a comment and a question, following up what Commissioner Christine indicated, that what are we doing in our respective provinces or city, in this case, City of Toronto. In my part, I sit on the Partnership and Accountability Circle. which it was designated and mandated by the City of Toronto to ensure to guide and support the full implementation of the Toronto Action Plan to confront anti-Black racism. So some of the work that we're doing is basically doing a lot of advocacy and pressuring the government and the City of Toronto, as well as the provincial government, in providing or ensuring that they will implement fully the disaggregated race-based data, whether it's coming from the health and sector, as well as policing. And I know that Mayor Tory and promised that he will look into it, and we will follow up with him when it comes to disaggregated race-based data, when it comes to the Emergency Act and the police, and the way in which they will disproportionately racially profile and target racialized communities, specifically the Black community, which has been shown in various research and data, including the Ontario Human Rights Commission, who've taken a strong leadership in actually making a statement, but also conducting their own research to show racial profiling and its impact on the Black community. So my question to both commissioners is, in your respective positions and the power in which you hold as Human Rights Commissioner, is what have you been doing from a structural point of view, rather than just talking about the reality on the ground? I don't think anyone is debating the reality of what anti-Black racism in the implication for our communities, specifically when we're living under a pandemic. What have you been advocating for and doing in terms of your respective roles to advocate and ensure that disaggregated race-based data are going to be collected, and in terms of communicating with the government entities in which you're supposed to have some form of accountability mechanism with? So that's pretty much really my question.
Marie-Claude, did you want me to start, or did you want to go ahead and start first?
Yeah, go ahead. I'll go after. Thanks.
Well, thank you so much for the question. I think, there's a lot of really good work that's being done in community in the Toronto area and Ontario. It's unfortunate Rainu was unable to join tonight because she's been doing a lot of work, as good work being done by the Ontario Human Rights Commission around things like racial profiling. They've been very busy on the street checks issue, very active on that side, and we've been staying in close touch as the street checks issue evolved down here in Nova Scotia. In terms of what we're doing on advocating right now for the data, we've actually been in discussion for several weeks now with a number of community organizations that have been advocating for health-based data for some time. We've been involved in quite a few follow-up meetings concerning the recommendations of the UN Working Group of Experts on People of African Descent, had very specific recommendations on this issue. I think it's an important issue. There has been headway made in Nova Scotia on the tracking of desegregated race-based data on the education side. This has not been done on the health side, and so there has been quite a bit of advocacy efforts there. Since the emergence of COVID, and in particular the emergence of COVID with a major outbreak in a Black community here in the province, there have been increased calls for the keeping of data, not just general health data, but specifically related to COVID-19 as well. So there have been some ongoing discussions here with researchers that are working on COVID-19 research. We're looking into how that could potentially work. I think sometimes governments can be very quick to say, well, it's difficult, it's a long-term problem, looking at how it might be tied, for instance, to healthcare cards. I think for the purpose of COVID-19, that wouldn't be necessary. I think it's actually, from our discussions that we've been having in the last couple of weeks, I think it would be not that hard to do. I think it's a matter of self-disclosure that could be done at the time of testing, or it could also be done at the time of someone being informed that they have received a positive test for COVID. At those two stages, a person is answering an awful lot of questions. They're very interested in finding out all kinds of things about health conditions and drugs you may be on, and whether you might smoke, and all that information. I think it would be just another question that could be asked. That information could be gathered, and I think researchers would benefit a great deal from being able to have access to that. And quite frankly, I'm not convinced that it's something policymakers are against doing. It's just that it hasn't been done because I think sometimes people think things are harder than they need to be. So this is something the Commission is very interested in. We've had a lot of discussions over the last couple of weeks. We're going to be pushing for this because it's important. And I think that, we've just seen clear evidence here through our own situation, how important it is for vulnerable communities to have supports. I mean, we're all one community here. We need to work together, and just seeing how difficult this has been for people in vulnerable situations, living in institutions, care homes, the situation in corrections, which fortunately has not deteriorated here in the same way we're seeing in Ontario and other parts of the country. It's incredibly difficult to watch, and it's so predictable because you know where these outbreaks are going to occur. One of the things that I was listening to the statement from Ontario, I actually did read that statement when it came out, referring to increased testing for vulnerable communities. I think that's a really good point. Aside from the keeping of data, which needs to be done to further study and for further informing policymakers, in terms of some things that could be done immediately to support people in marginalized communities who are particularly vulnerable to COVID-19 outbreaks, aside from assisting people in terms of the types of income supports they may need to be self-isolating or quarantined, just increased testing is something Ontario's talked about in their statement, and that is something that's been done in the Preston communities here. They opened up 2 additional assessment centers in those communities, and they're even doing door-to-door testing in those communities to help support the need for increased testing. So I think that's important as well, in addition to keeping data, providing more on-the-ground support, and where these outbreaks are going to pop up because a lot of people in those communities may be working in care homes, for instance, which is the case here. It's not that hard to figure out what might be needed. So we are advocating for that data. We're also doing some advocacy as well related to other vulnerable communities, people who are living in institutionalized settings, and so those discussions are ongoing, and they will continue. We're just at the beginning, and we're continuing to, like I said, to listen and to stay really close with community advocates who are keeping us informed. We can't do this on our own. We need a lot of help from our experts and our advocates and organizations. And I think everybody's really stepping up. So I feel like we're hearing a lot, and we're hoping that people just continue to talk to us and tell us what they're seeing and what they're hearing, and we'll continue to try to raise this with decision makers and to talk about solutions.
Thank you.
Alors,
You want to add on to Marie-Claude? You want to add
yeah. I just briefly had that again. For us, collection of data is really important. This is something that it's close to my heart. This is something that I intend to push for. We already had some. We continue to consult and have meeting with stakeholders and different partners to see how we can improve. Even though internally at the Commission, how we can improve the collection of data, make sure that we're going to have good use of it, and being able after that to push to close the gap and address different problems. And what we're going to look at is as well how we can at some point maybe call on the federal government to coordinate an action plan, a national action plan, in fact, to collect data, because there is the need for collection of data in provinces and territories. There is a need of collection of data at the federal level, and we need the coordination as well, making sure that those data will bring us what we need as information to close the gap and address different problems that the racialized population are facing, actually. And I don't know, Sasha, if you want to add on what I just say, but I think that
absolutely. It's so key to us that really having, the effective data is the minimum baseline that we need to know how to go forward, either federally or provincially. One situation we've been particularly monitoring is the situation in prisons. And that's, of course, of particular concern to our communities because we are overrepresented in the prison population, both federally and provincially. So, we have called on and supported the public safety minister's request of CSC, so the correctional services, to release low-risk prisoners where possible. So that's one concrete action that we're taking and that I think we'll continue to call for.
Excellent. We've reached the top of the hour, and I know that there's a lot of questions still to ask, but first things first, Christine and Marie-Claude, are you good to stay for another half an hour if possible?
Yeah.
Okay. Yeah. So going forward, in regards to questions, people were asking questions. Can you make them short? Because we have because we have great guests. Sorry, they're giving great answers, and there's a lot of questions in the queue. So next up, we have Anne. So Anne, if you have a question, please take yourself off of mute, and looking forward to hearing what you have to say.
Thanks, great conversation. And Madam Landry actually mentioned that she would certainly be more than willing to support the collection of data across the board. And if that's the case, since the government is really great at changing laws that we've seen with COVID, in the next few weeks, what could stop them from passing a law that would allow the data, the desegregated data, to be collected? So this is something that we could support. Can you hear?
You're a little bit faint.
Yeah,
You're a little bit faint. Can you come closer to your mic?
Put your headset on or come closer to the mic.
Okay, no, I don't have a headset. Can you hear me?
Barely.
Better. Better.
So I'll turn it up. My question was around the data, the race data. And since we've seen with COVID, so many laws being changed overnight, literally, would the commissioner support something like that to ensure that the government puts in place a data collection based across the board, with even gender-based violence, ITVs, everywhere where we collect data, that then becomes an automatic. One of the things with COVID, some of the things that are out there is that Black people, their symptoms are a bit different with COVID. So here's another thing for us to look at. I don't know if that's really good.
Okay. Christine or Marie-Claude, you couldn't hear her. So what I'm going to suggest, Anne, is maybe you want to type it out in the comments section. Yeah, if you want to type out, and what we're going to do is we're going to move on to the next person. So Robin, you have a question or comment?
Actually, before Robin, sorry, the queue is bouncing around just a little bit. Franklin was before Anne, but he got knocked off.
Oh, okay. I didn't see the queue when he didn't respond when I asked for it.
He didn't respond, but he came back on. But I think he got knocked off again. So yes, it is Robin now.
Okay, go ahead, Robin.
So I can get that sun away from me here. Hello, Christine. Hello, Marie-Claude. Thanks for being here. And first of all, to Sasha and Melanie, nice to see some color in the house, and not just in administrative positions, but in key positions. That's awesome. My question is on the personal case side. So I actually have a complaint with the commission. I know you can't speak the national one. I know you can't speak to that, but I've been told that it's going to take 2 years to have a decision on it. So my question is that the average? And if so, can that be sped up? Because obviously getting quick resolution to these things will help people, especially like Richard and I work with employees inside the federal government, and there's real issues with like the whole union process and stuff not being effective. So having the commission as a really effective, fast tool would be something that can help people. So I was wondering, can that be sped up, and is that 2-year period normal?
Yeah, first, I cannot talk about specific cases, and you will understand why, because I'm the one that at some point I will have to make a decision, or one of my commissioner. That being said, it's depend. It's some cases we deal with in couple of months. We are doing a lot of mediation, which is very successful, and many of the cases are resolved in very short period. Some cases are longer because of it could be the need of the complainant, it could be the complexity of the case, it could be, and it depends as well. Then we are a screening body, then we receive complaint, we are doing investigation, and after that we refer the case to the tribunal. But as soon that we refer the case to the tribunal, the case is not in between our end, it's between in the end of the tribunal. Then I would say that usually when you file a complaint, you can go on the online complaint form, or you can send an email. There is many ways that you can file a complaint. Then the case will be or the file will be attributed to a human rights officer. Human rights officer will get in touch with the parties, and if the file is completed, if the complainant provide all the information in a timely manner, if the respondent as well, we have some rule and we have some delay, and the objective is to deal with a case ASAP. Because certainly, as a former lawyer in practice, having dealt with a lot of people in vulnerable circumstances or situation, I certainly understand that time is the essence, and it's very important, and there is a lot of impact on people when they have to wait too long. And I would say that since the last couple of years, we had improved a lot. We had streamlined our complaint process, but it's depend of many factors can be or can affect the situation. I don't know, Sasha, if as a legal counsel, if you want to add something on that.
No, not really. I mean, this is just the, constant concern for every kind of body that receives complaints, the constant challenge to try to, do it as efficiently as possible, while making sure it's effective. So, I mean, yeah, all I can say is to just echo what you've said, that, we're continuing to try to look at our process and see where some inefficiencies are, and trying our best to address that. So, but no, I wouldn't say that 2 years is the average time that it takes at all. So.
Okay. All right then. Richard, you want to read June's?
Actually, I'll just read Anne's really quick. Her question was whether or not we can make changes to, I don't think it's necessarily laws, maybe it is, laws and processes to collect the data in a way that we have put laws and other processes aside very quickly to support responses to COVID. Do that in order to collect data, the disaggregated data that we're looking for. And is that something that would be supported by the commissioners to sort of expedite change processes so that we could start collecting the data fast, instead of what we have now, which is no data and no process to achieve it.
I think that what we can do as the National Human Rights Institution is certainly raise and make sure that we talk about the importance of collecting data. We understand that the government anticipates the legislative agenda is likely to change significantly. We will encourage, and we encourage those individuals that are in the most vulnerable circumstances to raise this awareness, and we will do so. We will talk about that. We will be happy to follow closely what the government, what's going to be the legislative agenda, and to make call for action when it's going to be needed. And but I think that it's clear for my counterpart in provincial jurisdiction. It's clear for myself that are needed, and this is something that we will push for.
Great, you're on mute.
Thank you. And June's question was in relation to
I think Christine wanted to add something.
Oh, sorry, Christine, go ahead. Sorry.
She's on mute.
You're on mute, Christine.
Can't hear.
I think she's on mute from her source.
Yeah, I think so.
Can you hear me now?
Yes.
Okay, sorry about that. I think Marie-Claude is very right. I mean, we have to advocate for this. I'm not convinced, in this situation, we've been really looking at this the last few weeks, I don't really think there's legislation that needs to be done around the COVID data. It's really just a process. They need to look at the process to collect health-based data, period, which is disaggregated race-based data. That's important longer term. But in terms of for COVID-19, it's probably as simple as just asking the question and asking people to self-identify at the time that they're tested. Or again, there's a couple of other options where that could be done. When somebody tests positive for COVID, I understand that public health officials phone them every day and ask them a bunch of questions. So to me, it seems like it's something that could be done. It's just a matter of deciding to do it and recognizing it's important. Like I said earlier, we're kind of watching mountains get moved right now in terms of the cutting of red tape and managing and changing processes to adapt to this crisis. And it's wonderful to see. But it's just, to me, it's a question of priorities. And so we're going to be really advocating very hard that this is a priority. It may seem like a small thing to some people who don't understand or are not focused on these issues. But for human rights commissions, it's up to us to make sure that human rights lens is looked through and to help decision makers understand why it's important. I think when you compare something like keeping this data to other things that have been overcome, I mean, they've been setting up whole assessment centers almost overnight to test for this. Adding one more question to the questionnaire doesn't seem like it should be that hard. So you can see we're seized with this issue.
Yeah, and if I may add, I think that one of the example is following the last election, we issue a statement calling on Parliament to, amongst other things, to develop a comprehensive approach to address the rise of hate crimes and shut down online hate and hold accountable those who spread it. Undertake bold reforms to address staggering overrepresentation of Indigenous and Black people in the criminal justice system, including reserving mandatory minimum sentences for the most serious crimes, implementing the missing and murder Indigenous women and girls call to justice, and end the inequitable funding for Indigenous community to ensure equal access to safe drinking water, adequate housing, education, healthcare, and child and family services. And all of these are important, especially now. And this is a kind of call of action that we are doing. And, and we will continue for sure.
Okay, thank you. Thank you. Very quickly, June's question was in respects to the United Nations Convention on the Rights of the Child, a comment from the commissioners. How does the present circumstance with COVID-19, how is it impacting on the human rights of children?
You want from myself, sorry, or Christine?
Either of you.
Either.
You could go first, Marie-Claude, if you're prepared.
Yeah, I think that this is something, and that this is a discussion that I had. I think it's yesterday or this morning. I don't remember because the time is going so fast. But with my team, I think that this is something that we need to monitor closely. As a national institution for human rights, we're the one that we reported on government and performance about human rights in this country. And this year will be the year where we're going to do our report on the rights of children and the respect of the United Convention for the Rights of Children. And certainly, but what I'm not sure is we are seeing some impact actually on children, but I'm sure that years and months and next month, and next years will show us bigger impact, because there is things that we cannot evaluate actually, but times will tell us what's going to be the impact in a couple of years for now. And I fear that they will be huge, and this is something that we're going to need to monitor closely, because yeah, sorry, yeah, Christine, you're mute, Christine.
You muted again, Christine.
How's that?
There
Yeah,
we-
yeah.
Okay, I don't know why this seems to be, I'm not even touching it. It seems to be doing it automatically. It's so obviously we're concerned, you know, the kids are out of school, and they're missing out right now on part of their education. Obviously there's some online supports, but the reality is, the hard reality is that a lot of kids are going to fall further behind, kids that are already marginalized or are in situations where they're disadvantaged. And the longer this continues, the larger the impact is going to be on them. So I think the space has to be watched closely, and the Department of Education is looking at how to reach out to children in communities where they may not have access to easy access to a computer or even reliable internet, just to try and make sure these kids don't fall further behind. So that's obviously of concern. And also, you know, just with the economy and the impact of COVID-19 on the economy, this is just going to increase some of those disparities, and children in poverty often will have very detrimental impacts. So I think this is something that has to be, the government has to continue to watch that, to try to protect children to the extent they can, and ensure that they have the supports that they need to get the best education that we can give them. But I think it's concerning, and I think it will take some time to see the full impact. It's not just, you know, when you think about it, like for my kids, it's a bit of a weekend every day. My 10-year-old daughter was saying it's a bit of a weekend every day, but we're homeschooling there, and she's got reliable internet, and we're providing a lot of support. But I do worry a lot about this. I think it's something we'll see it as a long-term impact, and there should be some mitigation strategies being put in place.
Yeah, and one of the things that we have to take in consideration for sure, it's due to the socioeconomic disparities that I was talking about. Not all children will have access to the tool that they need at home, and to have access to their education, and that's going to be a huge impact.
Okay, next question goes to Avi, and try to make your question short. We are running down on time. We got a number of questions we're going to try to fit in as quickly as possible. If we don't get them in, it's because of time. So just apologizing. So Avi, go ahead.
Sure.
Yeah.
Can you hear
Sorry.
me?
Yeah.
Go ahead.
Thank you. And thank you, Richard, for allowing me to join in this very important conversation. Wearing my hat as the clinic director of the Chinese and Southeast Asian Legal Clinic, we're certainly monitoring the issue around people with precarious immigration status. And I think that's a very highly racialized population as well, who are not able to access many of the benefits that the government has introduced. Also, people in precarious jobs, even if they have status, still also many racialized people, including Asian and African people of African descent. We're also monitoring the rise of anti-Asian sentiment. I share some of the polls with some of people on the call that showing that 1 in 5 Canadians poll saying it's unsafe to sit beside an Asian person on the bus, and 14% think either all Chinese and all Asians are a carrier of the virus, or they don't know if they're a carrier. And certainly, I think that is the anti-Asian sentiment in a way is helping the government in the Western countries by blaming it on another country, that they can just kind of hide behind, sort of the idea that somebody else is responsible for the virus, and therefore we don't have to look at the issue around who are being affected by the virus within our own country. And I think all of us here agree the collection of disaggregated race-based data is very important, as part of color poverty, color change, and we certainly raise it at the UN level as well, and also pushing the Ontario government But we know in the case of Ontario, our chief public health has already come out to say he's not going to collect race-based data. So my question is that at what point the government's consistent refusal to collect race-based data itself is a form of racial discrimination and structural racism that the commission can then go after the government, as opposed to just trying to advocate, but in fact, make a case out of their refusal to collect race-based data as an incident of racial discrimination.
Yeah, that was my question.
Who wants to go at that one first? Christine again.
You're on mute.
There we go. She's still on mute.
Again, I'm sorry, it's going automatic. Every time I don't speak for a few seconds, it seems to just put me on mute automatically. Maybe it's just, there's probably something in this program that it's worried about the loud rain. We actually had an incident here just a couple of weeks ago where a young Asian, a Chinese exchange student was actually thrown off of a bus, told that, you know, he might have COVID. So we are seeing incidents like that. It's incredibly unfortunate. You know, just in terms of the data, I mean, I don't know whether Kimberly Franklin, our senior legal counsel, is still on the line. I mean, she may be able to answer that question a little better than I in terms of the powers of our legislation to take more positive action there. We do have the ability, we have the power of inquiry under our human rights legislation here in Nova Scotia. That's normally used to get stuff that already exists. I'm not sure that that would extend to actually compel data to be kept. You know, if data existed and someone didn't want to share it with us, we definitely could go get that with our statutory powers under our legislation. I don't know if we can kind of force information, though, to be kept for us. That said, I don't feel like we've gotten a hard no here in Nova Scotia, so a different situation than Ontario. I think that, you know, there needs to be some work in helping decision makers understand why it's important. This government here has so far been quite receptive on human rights issues. And, you know, we did make a lot of headway on the street checks issue, but I can tell you just how important data is. We would never have seen a ban on street checks, I don't think, here if we didn't have 12 years of street check data behind us to show what was happening. Sometimes anecdotal stuff just isn't enough. It's this qualitative stories isn't enough to convince people. So I do think you're quite right. It's the data is key. We're pushing hard down here. We haven't looked at, you know, what else we can do beyond that. But I'm actually still quite optimistic that we're gonna get there here on the data side. So I don't know. In Ontario, it could be a bit of a different situation, but I do think that hopefully one of us can get there soon, and then maybe the rest will follow. Sometimes convincing someone to be first is more of a challenge. So we're working on it down here. We're going to try to be first.
Marie?
J'ai déjà mentionné plus tôt que je pense qu'une action concertée, c'est-à-dire peut-être de regarder comment, avec le gouvernement fédéral et les provinces et les territoires, et c'est possiblement même lors d'une présentation que nous ferons à Cachera, aux provinces, au fédéral et aux territoires réunis. Peut-être ça peut être une des choses qui sera mentionnée, réitérer l'importance d'avoir une approche coordonnée pour la collecte de data. Et on pourra en parler, Christine, lors peut-être d'une rencontre avec Cachera, sans vouloir m'engager pour mes collègues, mais je pense que this is a preoccupation that all commissions have, the collection of data, and certainly I think that many of our counterparts believe that it's really important, and I just mentioned that I think that maybe it's a discussion that we should have amongst ourselves and see how we can have a concerted or take one voice first to push on it and make sure that we will invite all of the province and territories and the federal government as well to have a concerted approach on it. And certainly if one provinces or the territories are taking the leadership, but they may show the example by leadership as well, which will be great. But certainly, I think that this is the actual pandemic show us how the collection of data is really key. It's important, and this is something that we need to do. We need to do more than just talking about that. We should get in action, and we should find ways to push for that.
Okay, Labe, it is now your time. You've been waiting for a while, and we do have to stop at 7:30. So this will probably be the last question. For those who haven't got their questions asked, we will see if we can get either or both our representatives. We'll send them the questions, see if they can get them back to us. So last question, Labe.
Yeah, thank you, Dr. Vibe. My question is regarding, I'm an international student in Canada here, and I don't know if this question I have for the commission is a question that can be assisted by them too, because we recently received a lot of news on international students in Canada with the help given by the government to assist international students in Canada. To assist students in Canada, but it was known that international students are not eligible for this help. The question is, I feel there is racial discrimination in the highest form, in a sense that the government is kind of removing, or the Immigration of Canada removing restrictions for international students to work for more than 20 hours a week, where Canadian students are given benefits. But my question is, don't we think that this is the highest form of racial discrimination, in a sense that these are, though there are some students that are part of the frontline workers, what about students that are not working and they can't go back to their countries to be able to get help from their families, but they are stuck here? What can the government also do? Is the commission also doing something to help international students at this moment of COVID-19? Because all these news is revealing that there is racial discrimination in its highest form against the marginalized people, especially Black people, and as international students in the country. International students are known to be working and contribute by paying fees and sometimes working, which is contributing to the economy of the country. So in this moment of this COVID-19, we expect the government to also do something to help international students. What is the commission doing about this to help international students as well to get help? Thank you.
Thank you for your question, and I don't think that you will like my answer, unfortunately. But we have no jurisdiction on this aspect. This is not something that the Canadian Human Rights Commission is allowed to talk about. We have no jurisdiction, and I think that my colleague Sasha will, as a legal counsel, will confirm that. There's no way that we can talk about that.
Yeah, and provincially we wouldn't have jurisdiction over that as well. But what I would say is it's really important to keep advocating. The government needs to hear about the gaps, and they have been attempting to address gaps as they're raised. In fact, just even the situations of students hadn't been addressed. So I do see a lot of optimism in the sense that the government is looking to adjust and add people to benefit programs who may have been where there may have been oversights. So I think definitely continue to raise this with the student advocacy groups, continue to raise this with your universities. Those are going to be your best bet in terms of advocating. I know here in the maritime provinces, our international students are incredibly important to us. They form almost 20% of our university students. They're our lifeblood here in Nova Scotia, where we have 10 universities. So I think it's very important that the provincial and the federal governments hear from you to let them know of this gap and this impact, and I hope that they'll step up to help address these gaps, because we're all in this together, and our international students do contribute a lot. I know here in my province and across the country, and so I'm hoping that's just a gap that will be filled if awareness is raised. It's actually the first time I've heard this this issue raised, but it seems like a huge problem, and we want to certainly support our international students here. So even though the Commission's not able to take this on, I hope that you'll continue to raise this concern with the provincial governments and your student union leaders.
Okay, folks, that is it. Oh, go ahead, Sarah.
Dr. Vibe, yeah. In response to the international student issue, just so you know, just today, the Senate held a session during which Senator Marie-Claude actually raised exactly what the last speaker was asking about. So maybe she might want to check with the Senate of Canada and contact Senator Marie-Claude, who seems to be really interested in that specific issue and who raised it today in the Senate of Canada.
Thank you for that valuable information. Thank you so much, Sarah. That's very much appreciated. Folks, we're right on deadline now, so we have to exit. But I'd like to say first and foremost, thanks to Marie-Claude, Christine, and their representatives for joining on the call. Do either of you ladies have any final words before we let you hopefully get some rest?
Christine, you want to go first?
I just want to thank you for the conversation. Actually, this has been the most exciting Friday night I've had in a few weeks.
Oh no.
Otherwise, I just get home.
Very sad.
But my husband's been watching the entire Rocky movie series with my daughters. I've seen them all about 6 times now. I think he's trying to classify this as phys ed, as his part of homeschooling. So anyway, this was a good conversation. These issues are really important to our Human Rights Commission. Addressing systemic anti-Black racism is our #1 strategic priority here in Nova Scotia because of our history here. So I'm happy to join in these conversations, and it's really good to hear what's happening in other parts of the country. It's always nice to see Marie-Claude, and so I just wanted to thank you for the good questions, and I wish you all well, and I hope you have a good weekend.
Thank you, Marie-Claude.
Yeah, I just want to echo Christine, say that thank you very much for having us. It's really great. When I've been appointed 5 years ago, my commitment was to improve things, to do my best, to make some changes. We're not perfect. We will not be perfect, but certainly I think that we improve. I take the engagement, or I committed to be out there, to speak out, to get in touch with stakeholders, make sure that the Commission will raise issues, and I think that this is what we are doing. And certainly I welcome all the discussions. Sometimes we may disagree, we may agree, but moving forward with discussion is the only way that we're going to make things move forward and improve what's going on in this country. And this is my hope. I still have 2 years in a row in my mandate, and I hope that in 6 months or a year from now, if I'm seeing you, you will be able to tell me that we're seeing some improvement. Then I thank you very much for this conversation.
Merci beaucoup d'avoir participé.
Merci.
I'd like to thank everyone for joining the conversation. Much thanks. We are going to save the chat and hopefully get some of the questions that weren't answered sent to our 2 friends and see if they can get back to us, either them or a member of their teams. Also want to say special shout outs to BIA Media for broadcasting it on their Facebook page. Also Sharon Fletcher for sharing it with her Wax Inspired community. Also want to thank my wonderful co-host, Sarah. Thank you so much.
Au revoir. Merci beaucoup.
Au revoir.
And also big thanks to Richard Sharp, who made this conversation happen. So big up to Richard Sharp.
Big up the man.
Yeah, man. Big time. And then finally, if people want to find out more information about UNDPAD or conversations like these, go to undpad.com and follow us on all social media platforms. All right. Goodbye, everyone. Have a
Thank you, Dr. Vibe. Bye.
Thank you all for coming.
And everybody.
Thank you, commissioners. Thank you for coming.